Thank you very much and good afternoon. For today, for our update, we are reporting 911 newly diagnosed cases of COVID-19 in the province, including 4 epidemiologically linked cases, bringing our total number of diagnosed cases in the province to 30,884. This is 153 people in Vancouver Coastal Health Region, 649 people in the Fraser Health Region, 27 people in the Vancouver Island Health Region, 47 people in the Interior Health Region, and 35 people in Northern Health. We now have 301 people in hospital across the province, 69 of whom are in critical care or ICU. And sadly, again today, we have 11 new deaths to report, bringing the total number of people in our province who've died from COVID-19 to 395. And the vast majority of these people were people in their 70s and 80s, our seniors, our elders, grandparents, spouses, family members. And I know there are 11 additional families out there who are grieving today, and we send our condolences to them, to their care providers, and most of the cases today were also people who are living in long-term care, and we know how challenging that has been this last year. We now have 10,430 people who are under public health monitoring and 21,304 who have recovered from COVID-19. We also have 3 new healthcare outbreaks at the German Canadian Benevolent Society Home, Villa Cathay and Morgan Place Care Home. And 1 outbreak has been declared over at the Peace Portal Seniors Village. That leaves us with 59 active outbreaks in our healthcare system, 54 in long-term care and assisted living, and 5 in acute care, involving 1,162 people, 718 residents, and 434 staff who are active cases at this time. I just wanted to remind everybody, as we have these large numbers of people who are being diagnosed in our province and under active monitoring, that as part of our contact tracing efforts, teams are working to identify if there's an outbreak or not. Public health teams may conduct or may ask and offer widespread testing of people, whether symptomatic or asymptomatic, in settings like workplaces, like schools, and long-term care homes, even if there's not widespread community transmission in that area. And the priority is to contact those who are positive first to make sure that people are isolating. So there may be a delay in people getting results in some cases if they're negative in these outbreak investigations. I've received quite a lot of, I guess I want to make one more comment about some of our data that we'll be reporting later today. The number of new cases, as we know, is one of those numbers that we all look at very carefully every day and pay close attention to. But equally important for us is, of course, the percentage positive of those who have been tested for COVID-19. Until recently, we have taken a holistic approach in that we include all testing that was done of everybody in the province and report the percent positives of those. This includes what we call testing under MSP funding, so people who have a billing number, and also non-MSP funding. And much of that is people who are tested for other reasons. It may be federal populations, for example, penitentiary, correctional officers, and other federal populations, including First Nations in BC. And as well, we know many of these tests are for travel, for sport, or for because they're required in industry. As our cases and our surge has increased here in BC, we've seen a difference in the percent positive between these two groups these two testing groups. Under MSP, our testing approach, as you know, has been to test people with symptoms, and the percentage, of course, is higher because in many cases we are case finding, particularly in a case of a cluster or an outbreak in a setting like long-term care or a workplace. The non-MSP tests include mostly people who are asymptomatic, although there are as well some related to investigations in clusters. And often there are people who are being tested multiple times for work or for travel. As a result, over the last few weeks, the difference in the percent positive in those two groups has been considerable. And now we're going to, with those getting tested multiple times in the lower non-MSP risk group, the percentage is quite a bit lower. Our weekly BC situation report, which comes out on Friday afternoons, will now show both of these, the MSP, the total, and the non-MSP, so that everybody can see what we have been looking at on a local level and the differences between those two groups. And that more accurately reflects some of the community transmission that we are seeing across the province. I've received a lot of questions, not surprisingly, in the last week about things like our indoor fitness group activities and, of course, the issue about gatherings and events and why some are included. Firstly, around the guidance for indoor group fitness activities. As you know, those activities, whether they're sport or fitness, are on hold right now. And it's the group participation that is the concern. So whether that's more than 2 or 3 people. Our teams have been looking at the evidence about this and looking at the situation around the world and to make sure we get things right so that when they restart, it can be done safely. And we hope that guidance will be available. I had hoped it would be available sooner, but it has turned out to be more complex than we realized. And that evidence review and the development of these new safe guidelines is ongoing, and I'm hopeful by the end of next week we will have those posted and more details will be available. I've also talking about the events and the mass gathering orders that we have. It's important to remember when we set quite a long time ago that 50-person limit for events, and we were consistent throughout this period of time in using that, it was the understanding that COVID safety plans would be in place, included in any event that was under 50. And the guidelines to develop the plans were based on what we were seeing and what we knew about this virus and about its transmission in the community and in indoor settings and other places. When we look at where transmission is occurring, we look at those things, and we've talked about this a few times. We know that some settings are more risky than others. So indoor settings, the types of activities can be more risky than others. So whether it's a wedding or an event where you're socializing with your group of people, or whether it's an indoor fitness class, and of course the people who are at that event. We know, for example, that social gatherings are much riskier because it's hard for us to resist that need to be close to people that we know and care for. Right now in BC, as around the world, at least in the Northern Hemisphere, across this country, in Europe and other places, we are seeing a much higher level of community transmission. This means that things that were safe, using the guidelines we had developed over the last 10 months, are no longer in that safe zone. This is different than what we were experiencing before in the spring, in the summer, and even earlier in the fall. This means that any location that was able safely to have gatherings even a few weeks ago, including temples, churches, gurdwaras, and other important, critical religious venues, are not safe today. I'd like to be clear that these locations are not doing anything wrong. I know vast majority have had very good COVID safety plans in place. They've had limited numbers of people coming for services. But despite that, we have seen outbreaks in BC, in churches, in multiple faiths, in multiple places in the province, in temples, in gurdwaras. So these are not decisions that we make lightly. We have seen transmission despite people's best efforts in settings, and we know that we don't want to be passing this on to people who may be at high risk in those settings. I've spoken about the fact that we are in a pandemic storm, our COVID storm, and now we are facing a storm surge, and that is something that we are facing globally. While we might have been safe to be close to the water, close to that edge, our safe zone has moved back. That sandbar where we can act safely has become smaller. That is why we've put in these restrictions now on those social gatherings, on those places, those events that were safe even a few weeks ago. And we all need to do our part to bring that community transmission back down, so we can resume those activities that are so important. It is a cruel irony in many ways that when we most need to be with people, that is the most dangerous thing that we can do with this level of transmission we're seeing in communities across the province. But we do remember that every storm ends and that the surges wane, and our focus right now has to be on doing that. I'd also want to put out my appreciation and gratitude to the many faith leaders around this province who are supportive of this, who are paying attention, who are supporting their congregants at this time of need, because it is a most uncertain and frustrating and challenging time. And now's the time more than ever. We need each other, and we need to be with each other safely. I know many people are looking forward to holidays ahead, the winter breaks, and many celebrations that are coming, and for some, preparations are underway. And for many retailers I know out there, this is a very big time of year, whether you're a small or a large retailer. And this is another area where we have uncertainty right now. And this weekend, I know many people will be thinking about holiday shopping, about things that they want to have and give, especially on what they call Black Friday today. So my message to you and my ask of you is, if you do plan on shopping, remember to keep your COVID safety plans in mind. And that means keeping your distance, wearing your mask, washing your hands, keeping your numbers small, keeping local, and limit your travel. Shop locally. Support our local businesses who need our support, whether that's shopping online and picking up, or booking ahead, or going at a time where it's not so busy. Support the businesses in your community. Please also remember that we need to stick with our immediate households right now. So no social gatherings. Do that remotely so that we're not passing this virus on to those that we care most about. And let's make this weekend a safe weekend for everybody. I know we are all feeling the strain, but I want to remind everybody of the importance, when we're in these stressful and anxiety times, of kindness and compassion, of not taking it out on others, of remembering that we don't always know another person's story. We've heard stories this week, and they make me very concerned and sad about store clerks and restaurant staff who have faced undeserved aggression from people who don't want to wear a mask. Please remember that this requirement to wear a mask in indoor public locations is a provincial order that everyone must follow, just as we do things like wearing seat belts and helmets and following the speed limits. This is something that you do to protect yourself and to protect others. And we need to remind ourselves that particularly when we're in indoor spaces, it is important for us to show the respect and protection for those who are working in those spaces too. It's a layer of protection for everybody and a courtesy to those around you. And if you are opposed to wearing a mask, then I ask you to shop online, order takeout, or stay outside, or stay home, and not put other people at risk. I remind all of us about the severity of this illness and the fact that we have people who are suffering in our hospitals right now, and their families are suffering too, and that these small, simple actions make a big difference for all of us. We are stronger when we work together, and this is not forever. It may be hard to see the light right now, but there is light, and we are planning, and we will work together, and we will get through that. And in this, we also have to continue to remind each other that kindness makes a difference, and it is kindness to each other that will help us get through. And we do that as well, staying calm and staying safe. Thank you.